I'm Dr. Leanne Brady, and in this video on deviations on opening, we're going to look at how I examine a deviation on open during my exam, the causes of a deviation on opening, and two patient examples of what that looks like from a joint and muscle exam. So the first thing for me that I do when I start to do a joint and muscle exam is, as you see in this video loop, I put my fingers in front of the patient's ears and I actually have the patient open and close several times. I'm actually feeling for the lateral pull as a location, but I'm also checking for a deviation on opening. So I eyeball an upper and a lower landmark and watch the patient move. Once I've got that located, then if I see a deviation on opening, the next piece for me is to figure out what the cause of a deviation on opening is. During normal anatomic and physiologic opening, the muscles fire in coordination, the anterior temporalis, the masseter, the posterior digastric, and the lateral pterygoid muscle, to smoothly, evenly, and with coordination open the lower jaw, and it typically will move straight up and down. If there is any change in this movement or there's a deviation in the opening, one of the things that I wonder is, what's the cause? There's got to be a why behind someone deviating on opening. So let's look at a patient example of someone who has a deviation on opening. So as we watch this video, we can watch that the patient's moving right and left or meandering back and forth as they go right and left. You can also almost watch the grimace as she closes. My first thought is this muscle-based? Is this a symptom of an occlusal muscle disorder? Or is this about a displaced disc? If I believe it to be occlusal muscle, and I have other information from the rest of my joint and muscle exam, I'll try to deprogram the patient and then have them open again. And I should see a change, diminishment in that deviation on opening. If, however, that deviation is because a piece or all of the cartilaginous disc has been displaced from the top of the head of the condyle, and the patient has learned a coordinated muscle movement to avoid locking behind that disc, then doing an anterior deprogrammer or a Lucia jig will not change that. So let's look now at another example of a patient who does have a deviation on opening that is relative to a partial displacement on the lateral pole of the condyle. This is important diagnostic information and requires being put together with the rest of my joint and muscle exam to move me forward to thinking about what is going on for this patient from a TMD perspective: joints, muscles, tops of teeth. If I suspect that there actually is a disc displacement that is at the source of what's going on, then it may require imaging, like an MRI, in order to verify that information.